Welcome to Renus Care Radio, a podcast focusing on the science of nephrology. Fluid management during continuous renal replacement therapy, CRRT, is crucial, particularly for critically ill patients who may experience rapid changes in fluid and electrolyte balance. Proper fluid management during CRRT involves a careful balance of fluid removal to correct fluid overload without compromising hemodynamic stability. Effective fluid management begins with a thorough assessment of the patient's fluid status. This includes not only clinical indicators such as edema, ascites, and pulmonary congestion, but also hemodynamic parameters that can be monitored through invasive methods like pulmonary artery catheterization or non-invasive methods like echocardiography. These assessments help determine the net ultrafiltration needs and guide the CRRT settings. The fluid removal rate during CRRT, referred to as ultrafiltration, needs to be dynamically adjusted based on ongoing assessments. Ultrafiltration rates are primarily influenced by factors such as the patient's fluid intake, ongoing losses, like bleeding or gastrointestinal losses, and the fluid accumulation rate. Nephrologists and critical care specialists often collaborate closely, using inputs from hourly urine output, insensible water losses, and administered fluids, medications, nutrition, etc., to adjust the CRRT settings. CRRT can significantly alter electrolyte levels and acid-base balance. The composition of the dialysate and replacement fluids is crucial for managing these changes. Typically, these fluids are tailored to mimic plasma electrolyte concentrations but can be adjusted based on the patient's specific needs. For example, in patients with metabolic acidosis, a bicarbonate buffered solution may be used to correct pH levels. Patients undergoing CRRT often have increased caloric and protein needs due to stress and catabolism associated with their critical illness. However, fluid restrictions can complicate nutritional support. The integration of a dietitian into the multidisciplinary team allows for the careful planning of nutrient-dense, fluid-restricted feeding regimens that support the patient's recovery while accommodating the fluid balance goals set by CRRT. Advancements in CRRT machines now include better control systems and sensors that allow for precise fluid balance management. Modern CRRT units can automatically adjust the ultrafiltration rate based on programmed targets and real-time input about the patient's weight changes and desired fluid removal rates. Fluid management during CRRT is not solely the domain of nephrologists. It involves an interdisciplinary team including intensivists, nurses specialized in dialysis, pharmacists, and dietitians. This team approach ensures comprehensive management, from adjusting fluid removal rates to managing the effects of medications on fluid and electrolyte balance. Effective fluid management during CRRT requires vigilant monitoring and frequent reassessment of the patient's fluid status and response to therapy. By maintaining a balanced approach to fluid removal and replacement, clinicians can improve outcomes for patients undergoing CRRT, minimizing complications such as hypotension and fluid overload. For more detailed guidelines, healthcare professionals often refer to the kidney disease, improving global outcomes, KDIGO, guidelines and other peer-reviewed resources that provide evidence-based recommendations for managing fluid during CRRT. Thank you again for joining us here on Renus Care Radio.